New at 4:30, former President Joe Biden is reviewing treatment options this week after he was diagnosed with an aggressive form of prostate cancer. The president's diagnosis is an important reminder for men to get annual screenings. WTVA's Wayne Herford spoke to a doctor in Tupelo today about the diagnosis and what it means for the 82-year-old former president. He's live in Tupelo with more.
That is correct, Tanya, excuse me. Doctors tell us that President Biden's cancer is treatable, but not curable. I talked to radiation oncologist Dr. Benjamin Hinton about that diagnosis earlier today. The former president's aggressive form of cancer has spread to his bones. It is not curable. Dr. Hinton says prostate cancer is one of the most common forms of cancer among American men. That's the bad news. But the good news is there are ways to catch prostate cancer before it becomes a life-threatening issue. Early detection and prevention are important. That starts with testings and screenings.
There is an effective screening tool, which is a blood test called a PSA test, and this is going to be the most common way for patients to know whether or not they have prostate cancer. When I ask patients if they would know about this cancer if not for the blood test, the vast majority of them tell me that they do not know that there's anything wrong with them, but for the blood test and the subsequent pathology and the cancer diagnosis.
Now, prostate cancer screenings are generally recommended to start at age 50, but if you have a history of prostate cancer in your family, one doctor recommends starting even at age 40. Now, men at higher risk or with a family history, as I just mentioned, should start at 40. So don't be afraid to go in and talk to your doctor about those screenings. A cancer diagnosis is obviously traumatic and difficult, but if caught early, it can be treated and possibly cured. Live here in Tupelo, I'm Wayne Herford, WTVA 9.